always a pleasure to be your doctor at this hour. Karibuni sana, all of you, wherever you're watching us from. Good morning, good afternoon, good evening. Welcome on board. This is a live that is going to talk about those antibiotics. This is a live that is going to show you how important antibiotics are. It is also a live that is going to show you how we abuse these antibiotics and the dangers that will come with you abusing these antibiotics. So this is a live that you should stick around, because through this live you'll understand antimicrobial resistance. You will understand something that we call antimicrobial stewardship. What does that mean? What is resistance? How do we get to resistance? What are some of the things that we do that actually lead us to resistance? Now, did you know that without antibiotics, all those surgeries that we are going through will not be possible? Did you know that? Did you also know without antibiotics, even a basic and an emergency surgery like a CS will not be possible? Did you know things like dialysis, invasive things like dialysis, procedures like dialysis, surgeries like kidney transplant, the prostate will not be possible? Did you know that? Did you know that if at all we had resistance to near all antibiotics, did you know you will even get afraid of just toppling and falling? Because if you get that wound, is a problem. So on this platform, everything that we do, we encourage you to fix your immunity through dietary modifications, through fasting, as we are doing right now. So that is what we do for a living. But above all, we understand that this information can only reach 1% of the population. And even though it reaches 1% of the population, we will still have people in that healthy population who will still need antibiotics. Remember, people who are immunocompromised, like the HIV patients, like the cancer patients who are on chemotherapy, they need antibiotics so that they can actually, the antibiotic can actually help or assist the immune system to fight infections. People who are diabetic, their immunity is going down. So if you fight diabetes and if you overcome the diabetic menace, you are at a very good place in terms of antibiotics therapies, because one, you will not need them, and number two, if you need them, it will be totally necessary. So therefore, you'll end up avoiding the side effects of antibiotics therapy. So tonight, we are going to discuss these things. We are also going to talk about how agriculture and the food industry have incorporated antibiotics in their products, and now it's becoming a serious problem. Okay, that beef, that chicken that we eat all the time, that rotates in a mirror. Okay, you know that chicken that rotates in a mirror? Those chicken are fed on antibiotics. How did they end up being fed on antibiotics? Are the antibiotics that are used in animals the same antibiotics used in human beings? Are they? Those are the questions that we'll answer on this live. And by the end of this live, you will be empowered to make sure that you respect antibiotics therapy, okay? You will not abuse it. So here, that is what we are going to handle tonight. So let me say hi to some individuals before we start this live, and I am excited to be here on a Friday, a fasting Friday, to bring you this health information. Remember this, on Tuesday, we are having our testimonial Tuesday. I'm advertising it this early because we only have this live and the live on Monday to advertise that testimonial Tuesday. It's not an advert, it's actually passing information to you. So join in and share your story. Bring forth that gentleman or that lady who has gone through our programs and has experienced healing. So bring them through so that they can share their story on this live. Okay? Also be here to be inspired. If you're not inspiring, be inspired. So join in at 8:30 on Tuesday, all the way to late night, as we bring on those testimonials. So let me say hi to individuals here. Safi is in the building. How are you, Safi? How is Uganda? Ugambachi. Jay Opande is in the building. We see Cecilia, I see Lago Steve, I see Friday Emanson, I see, who else is here? I see Winnie the Sue. Good, good, good. I see Waidira. If you don't pay the farmer, you will pay the farmer. From Dr. Lewis, my new slogan. If you don't pay the farmer, you will pay the farmer, as usual. Yeah? As much as you keep on saying, healthy foods are for the rich, my friend, the farmer does not know the difference. You will still go to that chemist and buy 3 capsules of antibiotics at 50 shillings. You still go there and buy cold cup for your flu. You still go there and buy metformin for your diabetes. You still go there and buy hydrochlorothiazide for hypertension. Losartan, the statins for hypertension. So if you don't pay the farmer, you will definitely have to pay the farmer. Choose you and choose the farmer. I see Nuwagaba, I see Lydia Mohongo, I see Cornelius Mutinda, Nicole is in the building, I see Alex Njeri, I also see Joab Oboge, welcome on board, gentlemen. I see Catherine Mudoni, I also see Kelebogile, ooh, what a name, Kelebogile. I see Siboniso, I also see Resho Lavender, I see Agustino Dindo, Masti Chepkurui, and all of you being here is a blessing to the health and wellness sport. And guys, thank you so much for the effort that you've put in to actually make sure that we are at 26,000 people on YouTube. If you're on my TikTok, we are at 170,000 people. Does that make sense? Does that make sense to you as a fan, as a supporter, as a host? Does that make sense to you? The slogan everywhere is #host. Oh man, this is exciting. And we have reached a point in life where, and I pray so much that all of you get to a point in life where positive comments do not excite you and negative comments do not upset you. Now, if you realized, on my platforms, there's always people who have information, and those people are always willing to share this information. Anytime you ask a question on my Telegram channel or my YouTube channel or even the TikTok's comment section, somebody is always willing to share their answers with you. Allow me to just make this one happen here. So there's somebody who is always willing to actually my people on TikTok, what is happening? I want to make sure that we are at par. Let's do this. Good. So let's do this. Good. Yes, sir. There we go. So yes, there's always somebody on my TikTok page, on my YouTube page, on my Telegram channel, on my Facebook page who can respond to your question. I don't necessarily have to respond to you, okay? So don't be a person who feels bad just because I did not respond to your comment. If you're still in your feelings, you still have a long way to go. Roll those sleeves and join our channel. Be deeper into it. Take a book, a notebook, and a pen and write those notes because estrogen has to be on the low in these platforms. But again, I told you, I pray so much that you get to a point where you have fixed your spiritual world, you have fixed your mental fortitude, you are now fixing your physical, and all these 3 things are going hand in hand. To an extent that if somebody tells you something negative, it doesn't change who you are. If somebody tells you something positive, it doesn't change who you are. Because we are not here for gratification. We are here to pass information. Telegram channel is Health and Wellness Sport. Yes, my Telegram channel is Health and Wellness Sport. Join that generation of people who will act as a support group to you. So don't be that person who is always seeking validation from people or gratification from people. You are enough. You are adequate enough. So when you're on this channel, you realize, even if you come with a negative comment or a positive comment, we will celebrate you for the positive comment. We will listen to you for the negative comment, but there's nothing that you're going to do different that will change our operations. You can encourage somebody through a video. You can make a video on TikTok that actually educates the masses. If you see something controversial, you can share your views because it's your opinion and you're entitled to it. You can share it so that you get to challenge you and you get to challenge us. Don't be that person who is there idle, sitting in that comment section, just sitting there to just pass your estrogen to other people. Be that person who is willing to do a change. If you see a post on Facebook that does not inspire you, don't say you are wrong. What you do is you write a good post that is actually countering that and that is informative. That's how we build each other. We are not here to compete. I'm not here to compete with you, and you cannot. There is only one Lewis. There will be only one you. Okay? So don't compete. Don't be that person who is always in a spirit of competition. Is good, but at sometimes just Be reasonable in your competition. I see Alex Njeri. I see, who else is here? Lillian Ayako. I see Aggie Kelly. Oh, Aggie Kelly. That's a new one or something. I see Sharon Kesio. I see Lydia Nyamisi. Judy Gadoni. Lois Makomele. Lee Kitur. Eve Kilu. Hannah Kimani. Ephraim Kabethi. Woo. I see Elizabeth Nyabange. Peter Makumi. I see you, sir. I see Frederick Randiga. And I see Kinudhia Kibuka in the building. All of you, I salute you and I say welcome to the Health and Wellness Spot. This is a place to be. I see 191 people on TikTok. As we tick-tack, let's learn. So today, antimicrobial stewardship. We are going to talk in support of antibiotics. We are going to talk against antibiotic resistance. We are going to educate you against literally everything. I see Johnny. John is in the building. I see Tony. I see Eva T. and Caroline Akonyi. Nancy Njeru is also joining the building, and Julius Koech, not to mention Mary Muturi. So welcome on board. Now, what is an antibiotic? Anybody who has an idea what an antibiotic is? Most of the times when you talk about antibiotic, Junior is in the building. Karibu sana Junior hapa. Karibu. So anytime, and even Molo, anytime we talk about antibiotics, people start to think that these are basically antibacterial agents. So you're thinking amoxicillin, you're thinking azithromycin, you're thinking any penicillin that comes into your head. Agikeli karibu sana. And Rudzani Tovale. So when I talk about antibiotics, bio means life. So which means antifungals are antibiotics. Hello? Those of you who still think that antibiotics is basically those drugs that act against bacteria. No, that's an antibacterial agent. Antimicrobials and antibiotics and chemotherapy are sometimes interchangeable. Because bio means life. So when you say anti-bio, you mean anti-life. So therefore, an antifungal is an antibiotic. But all of them, antifungals, antivirals, they are called actually antifungals, antibiotics, not antibiotics. Come on, Daktari. Antivirals, antifungals. But can we classify antivirals as chemotherapeutic agents? Daktari is in the building. Can we classify antivirals as antibiotics? Can we? Or antimicrobials? Can we? Viruses don't have life, right? If they don't have life, then how can we classify them as antibio? Unless the virus is into the cell, that's when we can say it has some form of life, but on its own, can we classify them like atazanavir or the antiretrovirals? Can we say they are antimicrobials? No, we can't. So an antibiotic is basically a substance that is, actually it has to be chemical substance that actually acts against the life of a microorganism. Okay? Take that to the bank. Now we're not here for the definitions. We are here to just make sure that what is happening here? Nviri Andrew is saying they are both non and non-living. What do you mean, Nviri? A virus on its own, it's non-living. When it gets into the cell, it becomes now living because it's now utilizing the cellular mechanisms to multiply and to actually survive. So if it is in the cell, can we now classify antiviral agents as antimicrobials? Yeah, okay, they are both living and non-living. Okay, yeah. But you see, a virus on its own, it cannot be living and non-living at the same time. It's either living, and when it's living, it is inside the cell. It's not a virus anymore. It's actually part of your cell now. But when it's outside, it's non-living. So we cannot target it even if it's outside. So why would we target it ikiwa nje? We need to target it ikiwa ndani because that's why it starts to corrode or to destroy you. But anyway, that is it. So when we talk about stewardship, we're actually talking about programs that advocate for appropriate dosaging in form of antimicrobials. Please don't confuse that. When I'm saying antimicrobials, I'm saying like literally all, including antifungals. So when you're talking about antimicrobial stewardship is just goodwill, just making sure that the information that is right about this medication is actually put out there. So, 1, appropriate drugs for appropriate conditions. On this note, how many of you have gone to the chemist and requested to be given a whole dose of amoxicillin for a common cold. And you tell that gentleman, if I have these chest pains, I know this is just pneumonia. I know I'm not coughing, but when I feel some pain here, I know that is my pneumonia. Now it's your pneumonia. So I know this is my pneumonia coming. So please give me the amoxicillin dose. And nowadays in the chemist, amoxicillin is being sold. Actually, let me just use the word amoxil. Amoxil is being sold. At least 5 capsules are being sold for amoxil. So now, and if you don't sell them, somebody else will sell them because people are in business. They have to pay bills, right? So if you don't sell them at 5 shillings, somebody is selling them. If you don't sell them at 50 bob, somebody comes and tells a pharmacist or a pharmaceutical technologist that I need 10 tablets. I'm amoxicillin 50. I need amoxicillin worth 50 shillings. And you see, antibiotics are not supposed to be dispensed just like that. They are not over-the-counter medication. They're supposed to be prescription-only medication, regardless of the antibiotic that you're using. So you buy an antibiotic for 50 shillings, you go and take it, and most of you don't even know metronidazole, aka Flagyl, is actually an antibiotic. Because just remember, it's antibio, so it's acting against against life. And of course, amoeba is a microorganism, so Flagyl or metronidazole acts against amoeba. So that's an antibiotic. But you see, the reality is this. How many of you have taken metronidazole dose to completion? 5 days. How many of you? Somebody is saying in Africa is not like that. It is sold over the counter. Yes. Most countries in Africa sell antibiotics or antimicrobials over the counter. So my question is, how many of you have suffered a stomach upset, went to the pharmacy, bought metronidazole dose for 5 days, those 15 tablets, or those 30 tablets, and then you've taken them completely. You've swallowed them for 5 days, complete. How many? Very few people will take those medications for a whole dose and clear the dose. But you see, antibiotics, when they are prescribed for 5 days, you need to take them for 5 days. And there is a reason. And I saw, what is his name? Is Doctor Who? Is it Nganga also on TikTok? He was actually trying to educate you guys about, those guys on TikTok, about the frequency of taking medication. I think most pharmacists and pharmaceutical technologists have become reluctant on this one. That when you're told 1 times 3, we have actually become a 1 times 3 people. 2 times 3, 1 times 3. If you're told 1 times 3, you go and take the drug in the morning, at lunch hour, and in the evening. That was not the essence of that incomplete sum. Yeah? That incomplete sum on that envelope, it was not designed to be that way. 1 times 3 is supposed to mean you're taking that tablet every after 8 hours, so 8 hourly. So simply divide your day into 3. That means you take it every after 8 hours, and your day, you combine the day plus night. It's about the 24 hours, it's not about the 12 hours only. So for you guys, you divide the drug, the day into 12 hours. Then you use those 12 hours and divide by 3. And you don't even divide completely. What you do is you decide, I'll take this at 7 in the morning, at 1, and at 5 in the evening, or 7 in the evening. That's a mess. And that's why these drugs are becoming actually resistant. When you're told 1 times 4, basically that antibiotic that is called flucloxacillin, that is used for the wounds, most people take 1 times 4 as it's written there. So you divide your 12 hours into 4 times. So you take it every after 2 hours, like literally. No, it's supposed to be taken every after 6 hours. And there is a reason behind that. And this is the reason. When you take any drug, that drug is absorbed. Okay? Have you ever asked yourself why you take paracetamol, it goes to the stomach, but then heals the headache? Why don't we sniff paracetamol? Why don't you make powder and just sniff it direct into the head? It's because it has to go to the stomach, and then you absorb it. It goes to the liver, it is activated, and then from the liver, it's now sent into the stream, into the bloodstream, into the circulation. And when it gets into the circulation, now it goes and attaches to receptors. That is me giving you mode of action of drugs. So you swallow it through the mouth, it goes into the stomach, it is dissolved in the fluids of the stomach, and that is where the problem comes in. You see, before I even go to the entire process, let me just educate you a little bit about the stomach. That stomach acid there is designed to make sure that that drug dissolves in it so that it can be easily absorbed. So the drug has to dissociate. And you see that paracetamol that dissolves in water and just the effervescent tablets, they have actually helped you to dissociate that tablet using water so that it gets into the stomach so fast, it's absorbed quicker and gives you action faster. Okay? So what happens is in the stomach it has to dissolve. So it disintegrates and then dissolves and then now it is absorbed. And then it's carried all the way to the liver. And in the liver decides where do we take this one? Do we clear him or do we activate him? And then do we send him into the bloodstream? So when the liver decides to send the drug into the bloodstream, the drug gets to interact with something called receptors. When it binds to those receptors, now it gives you an action. The headache disappears now. You see, that's a very long process. So the headache disappears. And that's how the drugs work. So if you have a drug that is formulated as a capsule, that capsule is intended to make sure that this drug resists stomach acid. That this drug is supposed to be deposited possibly in the small intestines. So that capsule is there to make sure that the drug does not get destroyed by the stomach acid, so that the capsule goes beyond the stomach acid, and when it gets into the basic environment, it can release the drug towards the small intestines. And now you absorb it directly into the small intestines. This goes to those people who are fond of separating the amoxicillin capsule and you drink the powder. Okay, there are those people who separate the capsule and then now you take the powder because you want the action to be very fast. You're so impatient. Hauna subra. So you separate the capsule and you drink the powder and quickly you flush with water. And now you're telling people, yeah, I am a strong man because I can take a very bitter powder of amoxicillin. You wasted that amoxicillin. You wasted it because that capsule is designed to make sure that it delivers that drug. Because remember, there is a difference between a medicine and a drug. A medicine is when you see paracetamol, the tablet, that is a medicine. What you're seeing is a tablet, and that tablet is not 500 milligrams because paracetamol tablet is supposed to be 500 milligrams. But that tablet is not 500 milligrams, is more than that. The active ingredient in this medicine is what we call a drug. So for example, if you have paracetamol 500 milligrams, we take that powder of paracetamol 500 milligrams, we give it diluents, we give it binders, we give it preservatives and all that. And then now we make a tablet out of that. So that tablet, of course, it can weigh about 1.2 grams, right? But 500 milligrams of that 1.2 grams is paracetamol. So the remaining is actually the excipients. We call them excipients. This is the difference between the original drugs and the generic drugs. So for original drugs, I've covered a lot of things there. Can we just relax first? There's a lot there that has to be sunk in seriously. And this for the medical students, and this also for the pharmacy students and the medical practitioners. So listen keenly. So you've taken a drug, and this, basically you've taken a tablet, that is a medicine. That tablet goes into the stomach, it dissociates. So you don't absorb the excipients. Basically excipients, the good word or the appropriate name for the excipients is the ingredients. Okay, so we have the active drug and then we have the ingredients. So these ingredients dissociate in your stomach acid and then they release the drug. Once they release the drug, what you absorb into the bloodstream is the drug, the active drug, not the excipients. Then this drug is carried from the gut or from the stomach all the way to the liver for activation. Because as it's carried there, it can be inactive, it can be more toxic, it can be less active. So the liver decides, can I make this one more active? Can I make them less active? Can I make them water soluble? Can I make them fat soluble? If I make it water soluble, it's cleared through urine. If I make it fat soluble, it remains in the system. Put that aside. So this medicine that you've taken, that paracetamol tablet, inside that tablet, we have 500 milligrams of a powder that is active paracetamol. But the paracetamol tablet, if you weigh it, it's more than 500 milligrams. Why? Because there are other ingredients that actually make the tablet. Okay? So if I have a capsule that has, let's say, doxycycline, 100 milligrams, that means this capsule weighs more than 100 milligrams. But the powder that is inside, the active ingredient is actually 100 milligrams. So the difference between original and generic drugs This is the difference. It is not like generic drugs are the fake drugs. No, that's the wrong way to interpret it. Generic drugs, let me start with the original ones. So you see, if I'm designing a drug to treat a certain condition, I will have to invest in this process, the process of manufacture, the process of all those things, the production cost. I will incur it myself, including the research. That's why it takes 8 to 15 years for you to develop a new drug. Imagine that, 8 to 15 years for a pharmaceutical company to come up with a new drug for one condition. 8 to 15 years. How long did it take that pharmaceutical company to make COVID vaccines? Hello? How long did it take that COVID vaccine to be manufactured? Those of you who remember, I always use that as a focal point because I know what I'm talking about. So it takes 8 to 15 years for you to come up with a new drug. So if I'm the one who is designing this new drug, what I'm doing is I'm actually investing in research, I'm investing in resources to make sure that I come up with this new drug. And then I invest in clinical trials and all that so that I make sure that this drug is safe for both those people who are healthy and those who are sick. That's a long process. Now, once that drug has been approved by legal authorities, now that drug can be released in the markets after the clinical trials. Now, what does that mean? That means I've spent a lot of money to just come up with that new drug, and then I call it my name. Let's say I call it Lewis tablets. That Lewis tablet is what is an original drug because it has been done research, it has been actually researched appropriately and maximally. We have done preclinical trials, we have done clinical trials and all that. Now we need this drug to be released in the market. When we release that drug in the market, there's something called patents. So I have to patent that drug. And I'm given about 25 years of patency. So that means nobody else can make a drug called Lewis apart from me and my company. That's an original drug. Now, after these 25 years have elapsed, what happens is, of course, there are people who cannot afford the original drug. It's very expensive because I'm actually recovering my cost of production and my research and my money. I have to return that money and then I have to make profits from that drug. Have you understood that? So that is the original one. But after the 25 years have elapsed, they actually is assumed that I've made all the profits that or the cost that I incurred to produce that new drug. So now I can release the formula to other people. So if you have your pharmaceutical company, I can give you that formula and tell you now this is the formula for making Lewis drug, Lewis tablets. Now use that formula to make cheaper alternatives. This is like China. Here is the Samsung phones. But you can make other forms of Samsung phones that are affordable so that everybody can have a Samsung phone. So that nobody complains that Samsung is for the rich. No. All of you can have vehicles. This is a Toyota vehicle. But because you cannot afford a Toyota, maybe Prado, this is still a Toyota. You can still drive. You can still be called a driver. You can still stand or park in a petrol station and fuel that vehicle, and you thumb chest yourself and say, I have a vehicle. So you can be counted in those people who have vehicles. Even if you call it a kadudu, it's a kadudu. You still have a vehicle and it's Toyota. So that's what happens. So now I give out the rights for other people to use my formula to actually make more drugs or new drugs. When that happens, every other person, because of business, they are running to take that formula and make their own drug. Take that formula and make their own drug. Now, the reality is, some of these companies will use very, very substandard ingredients. The drug will be the same. Paracetamol tablet will be the same. It will be the same. 500 milligrams of paracetamol tablet. But the ingredients that will be used to form these other drugs is the difference. Because I don't want to share my ingredients. I have shared the paracetamol, the formula. It's now up to you to start making your own ingredients and make sure that this one conforms to the standards of, they call it the British formulary. Okay, so that's how drugs are designed. So those generic drugs are not fake as such. But of course, the excipients that are used to make sure that you have this now Lewis tablet, which is a generic tablet, can be, of course, substandard. But that is not the same to counterfeit drugs. Counterfeit drugs are basically somebody lying to you that this is a drug that is paracetamol. It has Lewis inside, but it's not Lewis. Okay? Yeah, I've seen people sitting in a room and packaging unga, maize flour, into capsules and then selling it as though it's amoxicillin capsules. Yes, there are people who package different substances in capsules and then they sell it out as antibiotics, and you buy them, you guys, you buy them. That pharmacy that is near you and is not licensed is actually selling you counterfeit products. Those drugs that are crossing borders, the porous borders from other countries inside, and the pharmaceutical regulation bodies are, of course, silent about it because of the money. What is the difference between UK and India drugs? Very good question. There's no difference. Drugs are drugs, but the point is this, the same thing that I'm saying, counterfeits, one, and generic. India is the #1 producer of generic drugs. I really wonder why everybody is interested in medication from India. Everybody. And actually in Kenya, I think Kenyan companies for pharmaceuticals are very few. I think Dawa is one of them. Which other one do you know? Pharmaceutical company that is Kenyan based. Most are Indian, and Indians have specialized in generic drugs. They are #1 on the list of countries that produce generic drugs. And they have made it so perfect. Even their pharmaceutical syllabus is actually designed to be an industrial production. But Kenya, we've focused on clinical side, the hospital side, because most Kenyans like working in a hospital setup where they'll get to regurgitate the syllabus easily. Mbili mara tatu, moja mara tatu, 1 times 3. Beta Healthcare. Beta Healthcare is Lunga Lunga, right? I think so, yeah. Beta Healthcare is in Lunga Lunga. Somewhere down there along Nanyuki Road. Good, anyway, back to the antimicrobial stewardship. So what is resistance? Resistance means this. Listen, I told you, for a drug to be produced by a pharmaceutical company, we need 8 to 15 years of production. But microorganisms are actually mutating after 20 minutes to 1 hour. So imagine that. If microorganisms are mutating every 20 minutes to 1 hour, and you need 8 to 15 years to make a drug, imagine if we have drug resistance. Imagine if we have drugs that are not active against these microorganisms. How are we going to survive? Now remember this, surgeries depend on antibiotics for prophylaxis, prevention of infections. Remember, your skin has a lot of infections. So if you get a cut and your immunity is low, that means all these microorganisms on this skin will get into that wound and you'll get infected. That is what we call the sepsis. When it gets into the system, you get sepsis. If you get antibiotic resistance, surgeries will not be done. Even a simple procedure is not simple. It's actually not to disrespect the dentists and dental technologists. It's actually a complicated procedure. An extraction, a tooth extraction, will not be possible. A simple boil will finish you totally. We will not do surgeries like CS. We will not do things like dialysis. Imagine that. We will not be able to treat infections. And when I say to treat infections, I'm saying bacterial infections. Listen, I know that you've gone to hospital someday and you've been told you have blood infection. And then you put on several antibiotics. That is actually one of the reasons why we are having all this antibacterial or antibiotic resistance. Because we are told you have a blood infection and nobody tells you which blood infection. When a doctor says you have blood infection, ask them which one. You cannot just treat. Biodeal Laboratories, I don't know if Biodeal is a Kenyan one. And then Regal. Regal is in Babadogo, yeah. Regal Pharmaceuticals, yeah. Anyway, 80% of these pharmaceutical companies are owned by Indians. So this is the point. So when you keep on abusing that antibiotic, what will happen is, remember these microbes are actively mutating. So what is going to come up is, as they mutate, they are resisting those drugs. Sphinx is actually like a depot. It's like a depot. So Sphinx don't make, I don't think they make drug. They just, it's like testing. Not respect them, but as the truth. So like a depot. What you're saying is true. This is Angela Mudhoni. What you're saying is true. Rosephine and the generic ceftriaxone, difference is like 10 times. Yes. Yes. And you see, the problem with the general public is you are so smart. Google has made you doctors. So you're Google doctors. So you go to a doctor and tell them, I need the original drug. And now the doctor writes the original drug. And you give this to your babies. What you don't know is most of these antibiotics are broad spectrum. It means they actually act on all the microorganisms, regardless of the type, whether they are good or bad. They kill them all. Once they kill them all, those microorganisms that line your gut are actually your first layer of immunity. So you destroy your immunity. That's why after antibiotic therapy, chances of you getting a diarrhea are very high. And that's the reason why you take a pre or probiotic after antibiotic therapy. So it's always necessary to take these fermented cabbages after antibiotic therapy, even if it's 5 days, so that you replenish the gut microorganisms so they don't get diarrhea and you start boosting your immunity. Also remember, the antibacterial agents, the drugs were not brought in to help you heal. They were brought in to lower the bacterial load or the microorganism load to a certain level so that your immunity takes over. But the problem with you people is you are Google doctors. And again, you eat a very unhealthy food, so your immunity is already compromised, but you still think that drugs will come in to change your situation. Drugs cannot change your situation. What happens is they're supposed to just lower the burden, and then your immunity takes over. So the problem is you still weaken your immunity through foods. How many of you carry juices and fruits and honey and margarine and bread and sugar and pasteurized milk and ferry them to the hospital beds, to the wards, to give your fathers, to give your relatives and your friends who are there? How many of you do that? You make all these foods, the chapatis, and you take them to hospital. Of course, you're doing it with goodwill, but you don't have the information that you're actually lowering their immunity. So you're actually going to make them stay in the hospital for long times. Yes, even chips. So people are taking French fries to patients in the hospitals. And then you give them the Lucozades and the Ribanas and all that because you want them to get energy and boost blood and all that. And you just don't have the information. So all of you are in front of that. You carry those rose flowers to the sick person who has just come from theater, and with the very good GMO bananas and the pineapples and the yogurts and the cakes. Then you put them there. This person is, oh, these guys love me. But one, that is fake love, because you only show that love because they are sick. You only showed concern because they became sick. If they did not become sick, you would buy those cakes and eat them. You will not ferry them to them. That is one. Number two, you're taking their wrong foods. So you're actually telling them, bro, I want you to think I love you, but I want you to stay in the hospital for a lifetime. So you walk one step ahead and three backwards. You need the information so that you do the right thing. If you have to carry fruits, carry avocados there. Take meat to them. Take them the liver. Ferry them some fermented milk which is not boiled. Okay? Give them eggs. But of course, the sick people will also tell you, I don't feel like eating eggs because they give me nausea. I just want soda. When I take soda, I'm okay. And it was indoctrinated in us when we were growing up. Because I remember when I was a child, when you used to we used to know when you vomit that yellow substance, it's just automatically malaria. So when you vomit malaria, we used to say it that way, I'm vomiting malaria. So when you vomit malaria, soda will be ultimate therapy. And now they bring you that soda that has lemon. That soda does not have lemon, it has quinine actually. Did you know that? I don't know if this is the quinine that actually made us survive, but that soda that tastes as though it's lemon, it has quinine. Google the ingredients of that soda. It has quinine. What is an anti-malarial drug doing in soda? Then you drink it and you say, now I'm feeling good, I'm better. And tomorrow you're walking. And now, when you get malaria again, you've drunk soda that has an anti-malarial drug. What do you think will happen if you get an exposure to malaria again? Resistance. Resistance. Because you actually took an anti-malarial drug to treat malaria, but the dose was substandard. So this is the reason why quinine has become a serious problem. This is the reason why right now, for malaria, if not for artemether and lumefantrine, it's only artesunate. Quinine has been reserved. Do you know why? Because what is quinine doing in soda? And you've been drinking this soda all through, thinking that ladies were thinking that this soda is going to tighten their vagina. Men were thinking that this is the best soda to clear their hangover after a weekend of drinking. And they drink it. Now they are hit with malaria. They go to hospital. Therapy is not working. By the time you realize it, you have cerebral malaria. You're getting crazy. You're getting mad. The symptoms are there. And you're dying from malaria because of the ignorance that we are doing. Read the ingredients. Before you take anything in your mouth, read the ingredients. What is quinine doing in soda? Why? Anyway, so when you go to the pharmacy and buy that half dose of amoxicillin, when you have a common cold, most colds are viral, but you go to the pharmacy and you tell them, I want amoxicillin plus cetirizine. And then you use that, and then your cold disappears miraculously. You're actually causing harm to yourself, because there'll be a day that you'll get pneumonia, and that is the drug that you will need. Remember, amoxicillin is just part of a group of medication, antibiotics, that are actually called penicillins. It's a broad class, penicillins. So if you resist one, you resist all of that group, including injections. It doesn't matter. The bacteria is resistant to this group of drugs. It becomes chaotic. All of you, I have pneumonia, give me azithromycin. Oh, COVID, I want to prevent myself from getting COVID, give me azithromycin. And azithromycin is part of a group. So erythromycin is there, azithromycin is there, and clarithromycin is there. Those three are in one group. So if you resist one, you resist all the three. Imagine that. So how will you be able to solve your problems when you get the infection now? Right now, people are using amoxicillin capsules to chew mirror. Imagine that. They buy antibiotics and they use it to chew mirror. Let's be serious, guys. Let's be serious. Good. What is happening here? Let me sort this out before we continue. This is a sensitive one, so we'll go slow by slow until you understand it. Don't worry about it. So the first antibiotics were actually introduced during the Second World War. And the first gentleman who received antibiotic therapies in form of penicillins. Okay? Most of you know that gentleman who is called Alexander Fleming. That's the gentleman who actually introduced the penicillins in market. So that gentleman actually got a Nobel Prize. But the first person who received this, because remember that there was a Second World War, so people were being shot and the wounds and all that, and the risk of getting infections was there. And antibiotics became the magic therapy. Because when you just get this antibiotic, it disappears. Imagine having to worry about just a wound. Even a bite, when you bite yourself, you just worry about that because you will die. These guys were having gunshots and the bullets, and then now antibiotic therapy is here and it's going to change their lives for the better. Now, in this modern generation, the same antibiotics are being sold over the counter so that somebody who has a wound can just take a vial that has powder of that antibiotic and pour it on the wound. You've seen that? Ile dawa yangu ya kidonda. They pour it on a wound. Then the wound dries. They don't know they are risking resistance. But most importantly, the agriculture business, the agriculture industry. Look, animals were designed to be free range. Chicken were designed to be free range. The pigs were designed to be free range. The cattle were designed to be free range. But we confine these animals in one place. Then it becomes very filthy because they are there and urinating, pooping, and the environment is so filthy. So it's full of microorganisms. And then these animals, we feed them with steroids and very bad foods. Look at chicken. They are fed with very bad foods and the steroids to just fatten. And there are people who actually feed chicken with antibiotics to also fatten. So be careful where you're sourcing your chicken from. That's why this channel exists, to actually help you start saving in order to buy your own farm up country and start living a life there. The life in the city is actually corrupt. Everybody is here to survive. So this chicken, they are there in one place, confined. There are so many of them, and some of them get to break their legs. You see, those chicken that they are fed so much, in 6 weeks they are already, it's a full-grown chicken, and it cannot even jump. If it jumps, it dies. If there is noise, it dies of depression. And I put up a post the other day when I was saying dogs used to be very lean and fit, and they used to eat 1 meal a day. But nowadays, walk in the suburbs where these people who have dogs as pets live. Ladies and boys walking with dogs that are so fat, they're even struggling to walk. What do you think those dogs are feeding on? That aside, the chicken, so fat, but the water that they're being fed on, the foods that they're being fed on, are actually full of antibiotics, because they know when you stuff them in one place, the risk of them contracting diseases is very high. So they stuff them with antibiotics to fatten them and also to prevent them from getting infections. They call it prophylactic dosing. So imagine they've even made a name for it, prophylactic dosing. So they have doses for prevention of these problems in their chicken. This is because of the food industry, because the food industry wants them to produce this chicken in masses. A lot of them, so that they can feed the appetite that's actually coming from you people. So you are creating the demand, and therefore you're creating problems for yourself. Because when you create that demand, what they do is they have to make sure they feed you with supply. So now the chicken are feeding on these antibiotics, they are fattening, and every after 2 weeks, there's a whole new load of chicken coming out, and is always going into the food industries to make those sausages, to make that crunchy chicken that you eat all the time, that you line on those food parlors, to just make sure that you enjoy that crunchy chicken. You're just eating antibiotics at low doses. And as you eat them at low doses, you're actually getting resistance to antibiotics. Tetracycline is fed to cattle, tetracycline is fed to camels, tetracycline is fed to chicken, right? It is the same tetracycline that you take in form of the eye paste, the eye ointment. It is the same tetracycline that you give children when they are born, these new babies, so that it can prevent eye infection and the gonorrhea in babies. But this is the same tetracycline that you used to eat through chicken. So how do you expect your child to survive? They already developed resistance. The bacteria already had resistance to that tetracycline. So your child will still have eye problems. What are we raising? That same tetracycline that is being injected or given to that chicken or that kettle, it is the same doxycycline that you're going to use. Now, look at the irony. This is where it gets interesting. We give tetracycline to livestock, to the cattle, to the goats, to all those animals. And then we come and feed on that beef. And then we say, because you're so quick to tell me, if I tell you to drink milk that has not been boiled, you tell me, I'll get brucellosis. Okay? So now boil that milk and drink it. And then still contract brucellosis. What happens? You'll go to hospital and you're given 21 days of injections, either streptomycin or you're given injections for gentamicin. But on top of that, you are given doxycycline. Did you know doxycycline is a tetracycline? Did you know that? That tetracycline is just a classification, the broad classification. And tetracycline is the mother of all other cyclines, like doxycyclines. So doxycycline is actually coming from that tetracycline that was given to that animal that actually gave you brucellosis. And then now you're here taking another tetracycline and you expect it to function. It is not going to happen. It's already resistant. The bacteria are already resistant to it. And that's why most of you will go to hospital, treat for brucellosis, and still come back again for another dose. Still come back and test positive for brucellosis all the time. Even though I told you that those tests for brucella, for typhoid, and H. pylori are actually medical scams. But the reality is you will still test positive because this plays a role. There is resistance already. So that therapy is not going to work for you. So please protect yourself. Please stay away from antibiotics unless they are prescribed. I know you will not listen. I know you will not listen. But again, I already told you. So that day you'll go and buy that antibiotic over the counter. You want to take it for that common cold. You'll remember I told you common cold, most of them can disappear on their own because they are viral conditions. Most of them. When you'll be going there to buy that antibiotic, that amoxicillin, to use it to maybe chew your cut, your mirror, you'll remember I said this is an antibiotic and there'll be resistance. And when you get that resistance, you same person who is chewing that mirror, you're weakening your immunity. So you'll end up in hospital. What drug do you expect them to give to you? You expect them to give them benzyl penicillin? That is still a penicillin. It is the same to amoxicillin. So you're thinking this injection will be different. It will not be different. It's same. The formulation is the difference, and also the route of administration. So you expect to die in that hospital, and then you start saying, "Oh, this hospital does not have drugs. They have drugs, but you are resistant. These antibiotics are already resistant. The bacteria are resistant to those drugs, so they cannot help you." Sasa doc, when I was young, I used to fake sickness for me to get Ribena. Yes, all of us did these things. You would fake sickness to just get that. We used to call it bambucha. I just that Fanta orange tastes nice and you recover. Aye. Yeah. So as you eat that chicken, that is that broiler, just know it has been fed with steroids. Those steroids weaken your immunity. It has been fed with antibiotics. Those antibiotics will weaken your immunity because they will kill the bacteria in your gut. And there is a relationship between those microorganisms in your gut and mental health. Do you remember me telling you to fix your gut when you're trying to heal from mental health conditions? Do you remember? Right now, most people are depressed. They are not depressed, they've been diagnosed with depression. And they believe they are depressed. And instead of them fixing their gut, they still go and take antidepressants that will actually destroy the gut even further. So do you think you'll ever walk away from the big pharma? They will have you as a slave for a lifetime because you have a problem, they have made you believe that problem, they have now given you drugs that will worsen the problem, so you'll still go back for more drugs. And that's why when you ask your doctor, when will I recover from this depression? He tells you, this one I don't know. He might not tell you directly, but he will tell you, this one I don't know indirectly. So it's up to you to figure out what is he saying. Yeah? The same doctor who told you depression is idiopathic. It has no known cause. It's the same doctor who tells you, I don't know how long you'll treat this depression. Just be consistent with the drugs. Just be consistent with the drugs. And whatever comes out of it will be okay. So I want you to know this. Antibiotics are very important because one, they help you in wound healing. Number two, in that tooth extraction process, you need an antibiotic for prophylaxis. Number three, every surgery and every transplant relies on antibiotic, including CS, including kidney transplant. Every single one of them relies on antibiotics for prophylaxis, prevention of infection. Number four, every person who is immunocompromised, this is the HIV people, this is the diabetics, this is the people who have cancer and are on chemotherapy. They need antibiotics for them to survive. Number five, when you're giving birth, that new baby, and even those premature babies that are being born every single day right now, they rely on antibiotic therapy for them to be better. They need antibiotic therapy for them to be better. So if you continue messing up, you're actually affecting the life of those babies. And we know we cannot all of us live a healthy life, but we need to be very vigilant. Number six, imagine if you contract a sexually transmitted disease or infection. Do you know how stubborn it is? If you don't get that antibiotic, how will you survive? Skin conditions, they need antibiotics. Imagine that. So all these conditions are actually tied up. Even people who have a risk of stroke and they want to be put in those stents. Imagine that. You have to actually use antibiotics to prevent them from getting infection. How important are antibiotics? What is happening on TikTok? Good. We are back. Dialysis depends on antibiotics. So imagine all these things, you can never miss on one. You will have either one or two or even all. So you need an antibiotic. But you need antibiotics for a specific period of time. Make it even shorter. And they have to be prescribed. Because antibiotics therapy are necessary, yes. But as I told you, their role is not to help you heal. Their role is to lower the bacterial load to a certain level and then allow your immune system to take over. Don't be lied by that word, bacteriostatic and bactericidal. Simply understand your immune system plays a very important role in managing diseases, in treating infections. You need your immune system fixed. And we've talked about how to fix immune system through fasting, through eating healthy, through exercise, through the sun, through cold showers. All those things that we've talked about on this platform. Exercise them. Good, let's read some questions here. Such that even farmers are using harmful herbicides on veggies and even injecting animals, not just poultry, with steroids. Tufanya nini? That's Wangoi saying tufanya nini. What you do is, yeah, that question is from deep within. Tufanya nini? Let me read it as venye tu umesema. Tufanya nini? So the reality is this: there is much that you can do. You cannot solve every puzzle. You can't. But there's much that you can do. Do it. You can't ask that question when your supper right now was ugali, sukuma wiki, and some 2 pieces of meat that has been fried in seed oils. You can't ask that question if you have never fasted before. That when you fast, you have low energy. You will die when you fast. You have ulcers, so if you fast, you will die. You can't. You can't ask that question when you are overweight. You can't ask that question when you're having hormonal imbalances because it's an indicator there's a problem. You can't ask that question when you never exercise. You can't ask that question when you're afraid of running through the rain because you think the rain will give you asthma or pneumonia. That is a question that you should ask when you are actually doing something. You're eating 2 meals a day or 1 meal a day, so you're reducing the exposure. Number 2, you're fasting, therefore you're boosting your immunity, so you will not need antibiotics. Number 3, you're reducing the exposure through skin products. So you're not applying those sunscreen and all those products of the skin to lighten your skin. Number 3, you are always exercising. It doesn't matter if you're going to the gym or doing home workouts or walking. Number 4, you're doing cold showers without complaining whether the weather is sunny or it's cold. You're doing a cold shower. You're sleeping healthy. You're having 8 hours of sleep every night. That is therapy. So when you should be asking me, what else should I do if this, because the market is dirty, we cannot do anything. Imagine those counterfeit drugs coming in through the porous borders every day. They come through those porous borders. But can you do anything about it? The Pharmacy and Poisons Board is there to control this, but does it do it? Let's be honest, does it do it? It will do a crackdown once. And when it does that crackdown once, it will target the small business owners, the small chemists, so that it can use them as an example to other small chemists. But does it target the bigger fish? It doesn't. Those bigger pharmacies are owned by politicians. How can you touch them? They are owned by people in the Pharmacy and Poisons Board in Kenya. So how can you touch them? But they will use one person as an example. They will post that person in a magazine. They will post them on television. They will show them through the mainstream media so that they act as an example to other people who are trying to destroy their businesses. That's the idea. So it comes in with an ill will. It's not a genuine idea to change your life. Look at your Bureau of Standards. Today allows in this seed oil. Tomorrow is saying this seed oil is bad. The other day, the same seed oil that was bad is good. Today they announced on TV that sugar has mercury. Tomorrow the sugar is clean. It has to be used. Now they're talking about putting VAT on bread so that bread costs 100 shillings. We don't care, do we? We don't care. If you're in this platform, we don't care. But I just saw a lady. I just made a video on TikTok reacting to a lady who is feeding their child so bad foods. Did you see that? This is a child who is, I think, almost 4 or 5 years there, even lower. But this child eats 4 pieces of bread at 7 in the morning after eating 1 mandazi at 6:30 when they woke up. Children learn by observation and imitation. A child cannot do what a mother did not do. or her father did not do. That child is 3 years old, feeds on 4 pieces of bread, feeds on ugali as big as my fist, and then adds on sukuma wiki, and then add, of course, cooked in seed oils, and then adds on a pineapple. And this is a woke mother posting, taking these videos, editing and posting it to the public so that they can see how they're doing well. I'm like, where is the father? In all this, where is the father? Yes, somebody's saying that other girl, is it girl or lady, the one who got a media job, eating everything, and you can easily see in her videos, you can see the skin, how it looks bad. She has to put on some makeup to make sure that her videos are awesome. But what is happening to the skin? You know that time? Be keen when you're looking at those videos. Don't be excited with them eating a whole bowl of food. Look at the small things, the details. Open the third eye and see the skin. Look closely. Hormonal imbalance is in the roof. And now she's in the media industry. The next thing you will hear, depression. We shall be here and remind her that depression is in your head. Is in your head. Fix the gut. Anyway, let's continue. So antibiotic resistance has been a serious thing. And sometimes I look at it and you cannot complain enough, because even if you complain, who are you complaining to? Sometimes you see somebody buying 5 capsules of amoxicillin and you just wonder. Sometimes you see somebody taking these drugs and just takes 2 doses and they're done. They take them today, take in the evening, and that's it. Sometimes I see them being told 2 times 3, and the interpretation of that goes straight into 2 times 3, mbili asubuhi, mchana na jioni. You divide your day into 3 and you take in the morning, at noon, and in the evening. That's it. You're messing up. There is a reason why you take a drug that way, because when it's designed to be taken every after 8 hours, this means that that drug has to take 8 hours to attain a certain therapeutic level, and then starts going down. When it starts dropping into the blood, in the plasma, you can now top up the dose so that you have that stable curve and that maintenance, so that it helps you reduce the bacterial load. But when you're taking it that fast, one, more side effects. More side effects of that drug. So toxicity will be there. Number 2, you're actually wasting it. You're destroying yourself. But God was special. God designed you perfectly, that your system has to heal on its own. But you have to learn lessons, because when you take antibiotics, most of the times you get a diarrhea. Why do you think you're getting a diarrhea? Because you killed both the good and the bad bacteria. And now you suffer the consequences. And I repeat, after every antibiotic therapy, make sure you take either kefir or fermented cabbage or kimchi if you can access it. They will help you fix the gut back. They'll bring back the microorganisms, or even fermented milk, but don't boil it. Don't buy yogurt. Yogurt and fermented milk are not the same. Mala is not fermented milk. So they mess up your gut totally. Antibiotics mess up your gut totally. Therefore, you should not take antibiotics for the longest period of time. And if you're a medical practitioner and you sit in a hospital and you see a patient taking antibiotics therapy, even injectables, for more than 5 days, and there's no improvement, why are you still giving them antibiotic therapy? Please consider talking to the pharmacist to just help you to change the medication. But again, the pharmacist on the other side, they are just 2 times 3, 2 times 3, 2 times 3 every day, 2 times 3. 2 times 3, 2 times 3. They have stuck on that window, just dispensing. Where is medication therapy management? Where did that go to? Why did you go to school to study all these 5, 6 years to study and understand medicines, just to come out and stand on a window and dispense 2 times 3? Why? Anyway, so let me take in some questions from people here. I'm not here to market antibiotics. I'm here to inform you that antibiotics therapy are very necessary. But understand that you have to boost your immunity for that. And also understand that these drugs are not coming here to change your life for the better. They changed our life for the better from back then, when people didn't understand the basics of it. But understand this, for you to have effective therapy with antibiotics, you have to boost your immunity through diets and fasting. There is a reason why you lose appetite when you're sick. There is a reason you lose appetite when you're sick. So when you're sick, stop overeating. Why are you eating when you don't have appetite? Now we have to inject you an antiemetic so that you don't vomit. Now we have to load you with. Sometimes you look at people, what they do, you're just like, where? Should we ever? Should I just tell them? But if you tell them, they can't listen. You are sick. You've lost appetite. Anything that goes in comes out. So the body is telling you, don't eat. Let me fix the disease before you eat. But what do? You go and buy an antiemetic or an injection. You inject yourself so that you suppress the nausea. And then now you eat fruits, you eat sugar, you eat all these bad foods, the bread and the chapatis and all that, and the sodas and juices. And now the next time you're trying to eat, there's no appetite. What do we give you? We give you a multivitamin syrup so that you get appetite. You get that appetite, but you're still vomiting. We give you another antiemetic so that you don't vomit. Now you have appetite and you have suppressed nausea. So now you can eat bad foods and stay in that hospital bed for a lifetime. As long as you have a health insurance, I am counting on it. As long as you have money, I am counting on it. As long as you've paid consultation, I want you in that bed for the longest period of time. When you come out of that hospital after 7 days or a month, guess who is smiling to the bank? And you're the same person who will still come out of that hospital. You've paid a very heavy bill, but still tell me, healthy foods are for the rich. How did you pay that bill? How? Hey, it's time for you to open that WhatsApp group and tell those people to send you money for you to buy healthy foods. If you have the guts and the energy to open a WhatsApp group to collect money for your medical bill, you still have the same energy to open a WhatsApp group and tell those people, the same people will give you money for medical bills, to give you money to buy healthy foods because you are poor, right? You are poor, right? So if you are poor, open that WhatsApp group. Let them send you the money when you're still alive. Let them celebrate you when you're here, not when you're dead, when you're going in that hospital bed, so that everybody pretends to be loving you. Now they send you that 1,000 bob for therapy. Ewe, mwache uongo bana. Mwache uongo. Let's have conversations here as we finish this up. So don't abuse antibiotics. If you're somebody who abuses even these stimulants, the Mira and what, why are you doing that yourself? Guys, have you ever seen somebody who chews Mira? Have you ever taken a close look to them? At them, sorry. One, very bad teeth. They take that Mira with cigarettes and they drink soda, that is sugar. They now add on an antibiotic. Very, very bad dental formula. Very, very, very black teeth. And one of the most annoying things about people who consume Mira is this thing, the white things that come here. After chewing those you call them the leaves. Most of them, not the Mira, the sticks, but the leaves. You see the white things coming out of that. We're like, yeah. We talked about male grooming and stuff, and nowadays even women are chewing Mira. Why are you doing that yourself? A whole lady sitting in a group of people just because of the stories, the fake stories and illusions. Sitting in a group of men just to chew Mira. So you have 300 shillings to buy Mira. You have 100 shillings for soda. You have 50 shillings for water. You have about 30 shillings or 50 shillings for the groundnuts. That is how much? About 500 shillings every evening? But you don't have money to buy sweet potatoes. What are you telling me? 500 shillings. I only need 200 shillings to buy ghee. And you're telling me because of the stories that come out of that, you're telling me those stories are interesting. And even tomorrow, you'll not even remember those stories. And tomorrow in the morning, men are having erectile dysfunction. They now have to buy sildenafil to fix their problems. And now your eyes are so open because your immune system, your CNS is now activated. You have these bigger eyes than mine. Very wide open eyes, and now you want diazepam to just have sleep. So you activate your CNS so that tomorrow you depress it using a drug. Who bewitched you? Anyway, maybe it's me who hates on people who eat Mira. I don't hate them. I don't hate anybody who eats Mira. It's your business, it's your money. But just know, if you don't pay the farmer, you will pay the farmer. Somebody's, yes, vaccine. Somebody's, aye. And by the way, you guys get tired. Like, you have a whole thing in your cheek for the whole night. Aye. And you're so skinny because, of course, before you chew a mirror, you cannot eat. You're like, no, it's a luta. It's a luta today. You're going to listen to, I saw Kaveve Kazoze or something. We go to eat this mirror. So I'm going to eat my cat. Why would I eat now? Aye. We'll see you in the morning. And of course, somebody's in business. They will be there with diazepam selling it. Anywho, so guys, don't forget that we have our consultations that are going on, the physical consultations and the online consultations. They are so amazing. This is not marketing, this is reality. And you will hear those conversations on Tuesday when we'll be having like the testimonial Tuesdays. You'll hear those conversations. Everybody who has stepped up to just have a consultation with me physically or online, man, it's such an interesting conversation because it's always an eye-opener. You see, like this one, I'm talking to a lot of people, so it's difficult for me to give you the attention that you deserve. You can ask one question 1,000 times on the comment section, and you realize maybe I did not read it because, of course, all of you have questions. But when it's one-on-one, you have a chance to ask me those questions. You have a chance to ask me if I'm that guy who talks here confidently. So you can use that contact for consultation. Let me pin it on YouTube. Actually, on all my YouTube videos, that consultation contact is there. 0707 as usual. 074722. And please, those people who text on this contact, hello, hey, sasa, niaje, what are those? My friend, we don't have a whole day to just chat you. We can't do that. I mean, like some people think we are so idle. Just because we do these lives here, people think we are so idle. How can you come and ask me niaje? So you want me to say poa, and then now the next thing is ukofiti. I'm like, aye, bro, aye, yeah. Hey, please write well. Come and write a text and tell me this is my name and this is I want this help. Period. Make it short. Make it clear. The message is what is important, not how I am. If you ask me niaje, what if I told you I'm hungry? Now, will you figure out to send me money to eat food, or will you figure out to find money for consultation? Come on, let's be reasonable. Don't say the highs. Don't say, just simply text your name and text your problem. Period. We shall get to you. There are others who are flashing to just see if that contact is actually functioning, and that is so disrespectful. So you flash, then I'm told when you're called back, you ask, oh, nilikuwa nataka kujua tu kama inafanya kazi. We. Hey. So please don't do that. Let's be professional, okay? Come there, write a short text, because also don't write a whole text messages from the way you've started following me from 2013, and I wasn't even here on 2013. Tell me a short story, just simple. This is Lewis, and I need this from you. Period. That's it. You don't need a whole text to just get the consultation, right? Yeah. So let's stick to that, so that we can attend to as many people as possible. Because again, that limits our conversations with other people. Good. So that is the contact for the physical consultation and online consultation. The physical consultation will begin on 26th of this month, all the way to the 7th. That is in Nairobi. People are asking me, when are you coming to? When are you coming to? It's not like I go to Nairobi because I want to go to Nairobi. I go to Nairobi because it's work related. So when you plan a day to come to Eldoret, we will be there. We will communicate about it, okay? When you plan a day to be in Mombasa, like last year in November, we went to Mombasa and it was awesome. But this time we are in Nairobi, and we are actually making it a good stay there. So this will be continuing every end of the month in Nairobi until further notice. So again, thank you so much for bringing those people on board so that we can consult them. Thank you so much for changing lives of people. Wherever you are when you're on this live, thank you so much for liking the live and sharing it. Thank you for the presents, the gifts, the super chats, the support, the following, the likes, and all these things. I don't take them for granted because it's amazing. Somebody's asking me consultation fee. Why don't you just use that contact to ask that question? Good. Another one is asking me location, please. Hey, right now his location is on TikTok. TikTok is the location. We've pinned the location on TikTok live. So if you are on TikTok and you've never visited my YouTube channel, it is a health library. Simply go there, Health and Wellness Spot on YouTube. Subscribe there. We are at 26,000. By the end of this conversation, I guess we shall be very far already. Anytime we come out of these lives, we get to see a massive raise in the number. So thank you. Also, you can join my Telegram channel, Health and Wellness Spot. Be there, be part of the team that is actually supporting this agenda of healthy living. Because you and I, alone, I cannot do it. If you join me, we can make our sound heard. We can actually start to push for some policies here and there. But before that, we have to make sure that we have a ground, we have a base. And that base is not me. That base is you guys. That foundation is you guys. So that is how much I value you, and that is how much I value doing what I do, okay? Mary Namukose says from TikTok to here. Thank you so much, Mary, for joining the health train. Welcome on board. Today it seems like people are afraid to have these conversations. So let's call it a night for today until Monday. So guys, thank you so much for joining in. Thank you for being an amazing audience. It's been about 1 hour, 19 minutes of healthy conversations. Dek, you'll correct the date on live. Today is 17th, not 11th. Oh, okay. So it was written 7th. Yeah, thank you so much for that. I'll correct it ASAP. Thank you, thank you, thank you. Doctor, some fruits are injected with something to ripen fast. Yes, it's calcium carbide actually. Fruits are, this is Felicitas atideke. Fruits are injected with calcium carbide for them to ripen. Please stay away from those fruits. The GMO fruits, number one, they are genetically modified. So they are full of sugar, no fiber. It's a waste of your time. Full of fructose. And number two, they are cultivated using fertilizers and in a greenhouse. They are not natural. They don't have fiber. They are not bitter. They don't have seeds. They cannot attract flies. They don't go bad. Stay away from those fruits. And then after they have been harvested, they are actually injected with calcium carbide so that they can ripen fast. So please stay away from all those fruits. Nowadays, it's even hard to get guavas. And guavas are actually now genetically modified. I'll share a picture of GMO guavas that I was so surprised that nowadays we have GMO guavas. My friend. Do we have GMO eggs? I think we have GMO chicken that give birth to eggs. So I don't know if those are GMO eggs. But the chicken, yes. Doc, inaharibu meno ya watoto. Yes, it does, because sugar kills the dental formula. We will actually, next week, I think we can roll a conversation on a live about the oral health, right? So we can do a live on dental health or oral health generally, so that we can know where do we go south. What about thorn melon? Why is it that there is so much obsession from people with fruits? Why? When I say fruits, they are fruits. Whether it's a lemon, whether it's a papaya, whether it's a... So when I say watermelons have fructose, it doesn't mean papaya don't have fructose. A fruit is a fruit. Okay? Even if it's the dragon fruit that nowadays is selling a kg at 800 shillings. Stay away from them. Okay? Yeah, the higher the price, you might think that the healthier the fruit. You will suffer the consequences. I always remind you, do you remember quail eggs? So all of us ran to quail eggs, thinking that quail eggs are the solution to our problems, only to realize that that was a scam. And somebody had made a fortune out of those quail eggs already. So don't be that person who every time there's something new. Look at okra. Now we just realized okra is just a normal vegetable. Now everybody's like, anyway, I drank it. One day you'll drink that thing and you get the severe side effects. By the time you're realizing it's a scam, you are actually disabled. you will you will be disabled. So you can imagine. Now we have to fix disability. Doc, what about multivitamin in kids? So I think I have to end the live on YouTube. So guys on YouTube, thank you so much for joining in. I appreciate you. We'll see you on Monday. So we have a live on Monday, on Tuesday, on Wednesday. We rest on Thursday, another one on Friday. So we have 4 lives lined up next week on or next week from Monday all the way to Friday. We only rest on Thursday. So enjoy your night and let's see you on Monday. Cheers.